do an intradermal injection, you need to prepare the medication with the 6 rights, which are patient, time, drug, dose, route, and documentation. Check the MAR, and it is Skip Rocker, and he needs a TB injection. The dose is 0.1 ml intradermal today, and to report the results to the MD in 48 hours. Okay, and then we gotta check the vial. It's unopened for any cracks, expiration date, anything that does not look safe to give or abnormal. If it's a multi-dose, then you have to look for the time and date and initials of the nurse on the vial. Then you have to roll it between your hands. To mix the medication. And then take off the top. And use an alcohol wipe to wipe off the top. And then cap the needle. And you want to pull back 0.1 mils to keep it sterile. And this is just air into the vial. And then you want to pull back that medication. And you don't want any air bubbles. And then you can double check you got the right amount. And then to recap the needle, you want to use one hand. Okay, next is, now that you got the medication, and you have to make sure it's the right amount to the MAR, and it is 0.1. So now you go into the patient's room and ask for his name and date of birth, and his name is Skip Rocker, and his birthday was January 1st, 1972, so he should be 42 years old. And then we're going to explain the procedure, that he will be getting an injection today, just above the skin, that it will leave a little bump, and it's to check for tuberculosis. And then you have to ask if he has any allergies, and he does, and it's Celebrex. And then check the right medication, and it was the time, make sure it's the right time, right route. Okay, and then the sites of an intradermal, we're going to do it on his forearm. So he could be sitting up and with his arm out. Okay, now we apply gloves. Get another alcohol wipe. And then you wipe the area in circles. And And then you let it air dry. You don't want to fan it. Okay, once it's dry, you take off the needle cap. Make sure the bevel is up. And then with your non-dominant hand, you want to pull the skin taut with the bevel up. You want to in a 5 to 15 degree angle, you want to go right underneath the skin. And you want to be able to see the needle inside, like right above the skin. And you want to slowly inject the medication until you see a bevel. But if there's not, do you just want to see if there's a bump or not? Then you put your needle into the sharps container. You don't want to recap. And the bevel looks like a little, like a bubble. It's like a wheel, and it's tiny, and it can be red. So then you want to use a cotton gauze pad and just blot the area if there's any blood. You don't want to massage or put a band-aid over, because now you can't see the site. And then with a pen, you want to, where your bevel was, a wheel, you want to put an 1-inch circle around. So when the patient comes back in 2 to 3 days, that you can see where the injection was. And then I'll tell the patient to come back in 48 hours so he can have his site checked for any reaction. Then we would want to document how the patient handled the injection, that he will come back in 48 hours, that he will make an appointment to come back, what medication we gave, what arm or what place on the body we gave the medication, how much medication, the route, just basically the 6 rights in documentation. So patient, time, drug, route, documentation, and dose.